with faithful leaves.
It is about 12 minutes past 7. Globally, 35 million people are living with HIV/AIDS, and this year's World AIDS Day is focused on working to make that number zero. Here this morning to tell us more about what the plans are for the Cayman Islands are Laura Whitfield-Alniski.
Perfect.
Do this, yeah. With the Health Services Authority, she's the HSA HIV coordinator, and Carolina Fajeda with the Cayman Islands Red Cross. Good morning. Thanks so much for being here. So the theme I just mentioned is getting to zero, so that's zero new infections and also zero discrimination. These are two very, different goals that require a lot of activity really to reach both. So what's the plan?
There's actually 3 goals in getting to zero. So as you said, zero new infections, zero deaths as well related to AIDS, and zero stigma and discrimination. So zero new infections, the HSA is promoting that through free testing this week, Monday to Friday at all district health centers. Zero new deaths related to HIV is promoting treatment for everyone who has HIV, and HSA provides free treatment and care for those persons with HIV. As you said, stigma and discrimination is a bit of a harder topic to grasp and to get to zero, and through other awareness sessions that we do throughout the year, not just around World AIDS Day, with Red Cross ourselves, we try and combat that as well. Carolina is doing a HIV 101 this evening with her Red Cross volunteers, and trying to get zero stigma and discrimination, hopefully through ways of education, through the public, and trying to get them to understand HIV and the person with HIV, not just the disease.
What are some of the common misconceptions that here in Cayman that seem to lead toward discrimination?
I think a lot of it is, there's still, because of the lack of information about the transmission of, this is with any virus, right? Let's just be realistic. I mean, we're calling it fear Ebola now because nobody knows anything about Ebola really, so we make up these myths. With HIV, even though it's been around for such a long time, we still don't understand that transmission only happens essentially in 3 ways. Blood-to-blood contact, meaning you come in contact with HIV-positive blood and it has access to your bloodstream, so through sharing needles, if the needle has contaminated blood in it, doesn't matter what's in the needle, right? Whether it's insulin or drugs, and once you're sharing needles, you're putting yourself at risk. Unprotected sexual activity, and again, in terms of doing that, and how do we define, in terms of sex? Because the way that we talk about things, and a lot of times, sometimes people think that activities such as oral sex is not sex because it doesn't really count. But again, you can transmit not only HIV but other STIs through that, and also mother-to-child transmission, which in itself can be transmitted in 3 different ways. So it's just like, so then this notion of HIV can be transmitted through a mosquito bite. It can't. Like if you actually get people to sit down and think about those things, because show of hands, how many of you have actually been bitten by a mosquito, and then how fast did you run to HSA to get an HIV test? And it's like, but we kind of get into some of these things in terms of this notion of this is how it happens. So there's also this notion again that somehow it's the responsibility of the person who is HIV positive to ensure that they are not infecting other people. Or we hear these horror stories about how people kind of come out on a vengeance kind of binge and whatnot and have unprotected sex with as many people, and isn't that horrible? We need to take it back to the fact that it's down to personal responsibility. If you are choosing to have sexual contact with somebody, if you're choosing to have sex with somebody, and you don't talk about testing and you don't get tested, if you don't insist on condom use and all of those things, if it is a consensual act between 2 people and not sexual assault and rape, you are assuming that responsibility for the infection. So it's always this constant notion about only certain people get HIV. Someone is giving it to someone, you can catch it, it's not airborne, it's not a ball. So it's just like, so we kind of have to make sure that we break those things down. You can't tell by looking at people and whatnot. So it's all of these things that kind of contribute to the miseducation and misinformation that's out there.
And Laura, in the 80s when this disease was first identified, it was deadly. It was incredibly deadly, and the outcomes are different now.
That's right. Yeah, it definitely was a death sentence back in the 80s, and that's no longer the case. Another initiative that Cayman and our region has taken on is 90-90-90, and that's 90 people that in the population know that 90% of the population know their HIV status, so it's positive or negative. So through the free testing, hopefully we'll get a big population coming through. Also, those people that are infected be on antiretrovirals, and of that population that's on antiretrovirals get viral submission. So meaning that they take their medication, the virus is depleted in the blood system to an undetectable level, and if it's undetectable, then they can live a long and healthy life. So it is no longer a death sentence.
It is
they can live, they can have children, they can have a long, healthy, happy life if they take their medication. Obviously the medication is very expensive, and it can also cause a lot of side effects, which cause great harm and can be great discomfort to the individual. But thankfully, it's no longer a death sentence.
Okay. And I want to mention, you said it earlier, but it's free HIV testing all this week at Health Services Authority.
Yeah, at all district clinics.
Okay.
Georgetown, it's myself that will be doing testing Monday to Friday at 9 to 1. West Bay's doing it Monday, Tuesday, Thursday, Friday. And the other district clinics, Town's Monday to Friday. All the information's on our Facebook page, our website, sent out by emails. If you have want any further information, I can give my telephone number. It's 244-2507. Free, confidential results should be available within 24 hours, if not 48 hours. We're also doing some community testing. So Tuesday and Thursday at the Cayman Aids Foundation in the afternoon, and Wednesday at Red Cross from 5 to 7.
All right, Laura, Carolina, thank you so much for joining us this morning. We're going to have to talk again because starting in January, there's going to be free HIV testing year-round at the Red Cross. So we're going to need to find out more about that. We're out of time right now, though.